Matas. Nice to meet you on ESTRO 2025. And we want to ask you which new opportunities we have from patient mobilization, from Orfit.
Okay. Hi, Olga. First of all, thank you for having me, and thank you for being able to speak for your new association of radiation oncology in the UK. Congratulations. Let me tell you maybe a little bit first about Orfit. So Orfit is a Belgian company. We are family owned, and I'm the third generation CEO. And we're here at ESTRO to present our solutions to the public, to the end users, to people that use the immobilization devices every day. We are a company that manufactures the thermoplastic materials ourselves, so that's why we are always able to guarantee very stable quality and to make sure that every mask that is in the field being used on patients that is always of a very high quality standard. That's not always the case with other companies in the field because they don't have this process in-house. So that's the first thing. And why are masks good? They have a very constant level of shrinkage when they're made on the patient. They don't stick to the patient. Hair or head or body. They are comfortable for the patient, but at the same time they have to immobilize the patient to the level that is needed to give an effective treatment, to irradiate the tumor as much as possible and as little as possible around the the healthy tissue around the tumor. So.
Okay, and sometimes we have patients with claustrophobia.
Yes.
And I see new masks with two layers, not so open face, but smaller.
Yes.
Yeah? Maybe you can say something about this.
Yes, absolutely. So the open face mask was originally made for claustrophobic patients, some patients that cannot be under a closed mask during the whole treatment. But now with the surge and the rise of the SGRT, the surface guided radiation therapy, those type of treatments, those type of techniques require an open face mask, and that's why it's something that is being used more and more. Now there is a delicate balance between the size of the aperture of the mask and the level of immobilization. So we try to take the best of both worlds and make the aperture big enough so that the SGRT cameras can see it, and small enough so that the patient is immobilized correctly and that the irradiation can be delivered in a safe manner to the patient.
It's pretty good for patients with claustrophobia and also for fixation this patient.
Yes, absolutely. Yes. You know, I don't work in the clinic, so I don't know how common it is to have patients with claustrophobia, but I hear that it's up to 10% sometimes of the patients that cannot stay under a closed mask for the duration of the radiation therapy treatments.
Thank you. Thank you for your interview, and also thank you for your work in Orfit and for so good devices for treat patients with cancer.
You're very welcome.
Thank you. Nice to meet you.